at any time.
Thank you very much. I want to begin today by acknowledging that we are standing here in the heart of colonial power on the territories of the Anishinaabe, the Haudenosaunee, Wendat nations, and in the traditional territories of the Mississaugas of the Credit. It's our nations and peoples who first bore the brunt of colonial violence and disablement on these territories, and it is our nations and peoples who fight for the liberation of all disabled people across these territories. Good morning, everyone. My name is Brad Evoy. I'm a member of the Hullabu Mi'kmaq Nation, and I'm the Executive Director of Disability Justice Network of Ontario. We are here as a part of a coalition of disabled people, group home survivors, and family members working to reshape systems of care here in Ontario. But our work is built on decades of struggle in our communities for justice and to break free from vile institutions. We have to note the recent passing of Marie Slark, a beloved community member of the and beloved survivor of the Huronia Regional Centre, who fought the government as representative in the class action lawsuit for abuse and violence that people diagnosed with intellectual disabilities experienced at Huronia. Her fight is our fight. We owe her and her generation of disabled organizers everything. As Marie once said, I think people need to listen to us more. They should know what went on in institutions and that we are telling the truth. The more challenged a person is, the more help they should get, and not just hide them away. People should be in a home of their own choosing, close to their friends and family. This, friends, is why we are still here. We are gathered here today to begin a new stage, a new chapter of our coalition work together to end the abuse, violence, and death found in Ontario's group home system. We are gathered here at the start of National Accessibility Week to challenge this government and all parties to support disabled people, our families, and our communities in building an Ontario where we have direct, personalized funds and supports to live as we choose. Where we have clear legislation that protects our rights and our capacity to make decisions with support. Where we have the means to hold powerful private group homes to account for violence, death, and further disablement that our communities experience. Where we know that we can afford to live in our communities and afford the care and housing that we need without red tape and with organizations built by us, for us, to support us. Now, we know that disabled people's victories in the past, deinstitutionalization, ending asylums, fighting every day for new funding and support, those victories are fragile and under threat today. The group home system is one part of a wider shift towards re-institutionalization of disabled people, from the youngest children to the most senior elders. Further, we know from our review of the data that 233 disabled people died within Ontario's group home system from 2020 to 2022 alone. And we'll be back soon with a further release of that data in a searchable database. This data will include stories from disabled people and their families, stories of disabled people dying from fires at group homes known to be fire traps, from choking to death alone, Stories of homicide and serious accidents caused by medication errors and mistakes. Stories of misused restraints, inappropriate restraint, and abuse. Stories of families finding finger marks bruised onto their loved ones. And stories of mass COVID-19 outbreaks spread unabated, much like we see now in our prison system. And this is the plain reality of the group home crisis in Ontario. And let me tell you, disabled people and our families have had enough. The crisis is immediate, it is real, and it will only get worse without immediate action. We need direct, personalized, individualized funding to all disabled people and families that need care. We need to establish a province-wide agency to support families and individuals receiving care funding. We need to develop an Ontario-supported Decisions Act so that we can be full legal persons under the law no matter our circumstances. If they can do it in New Brunswick, they can do it in Ontario. We need to establish an interim independent oversight agency to monitor developmental services, enforce compliance with the law, and prevent abuse. And ultimately, we need to raise ODSP and OW rates by double, continue to commit to future increases, close loopholes in rental housing rates, and increase institutional allowances within places like group homes to an equivalent dollar value. We also need to improve publicly available data on medication errors, disaggregated information on group homes overall, around causes of death, illness, outbreaks, choking, use of trespass orders, and resident evictions. And finally, we need to address the safety risks that are all too real for our families and community members. Minister Parsa, Premier Ford, disabled Ontarians deserve and demand better. We believe our policy brief here, right here, is an opening step towards building a better Ontario where our communities, our families, all disabled people are protected and free to build our lives with financial independence and dignity. To close, I'll quote Mary Slark once more. Never open any more institutions. And if your kid has a disability, don't send them to an institution like that. There are other ways to get them help. They don't need to be put away. We don't need to be put away. We can fight against a new tide of institutionalization. We have the solutions right here to build a world where our friends, our family members, and all disabled people in Ontario can really be free to live where they want to be. With that said, friends, I'll pass things over to my friend and fellow coalition member, Carolyn.
Thank you, Brian. Good morning, and thank you for the opportunity to speak today. My daughter is 35 years old and has lived in a congregate care home setting since she was 21. This was not a decision I wanted to make, but I was told it was in her best interest that she needed to be independent of me. My daughter is a beautiful girl. She's brave, she's very well liked, and she's the apple of my eye. She is also nonverbal, medically fragile, and depends on others for every aspect of her care. Women with intellectual and developmental disabilities face significantly increased risks of gender-based violence. Research shows that over 40% of women with intellectual disabilities are sexually assaulted in their lifetime. often by people entrusted to care for them. Nonverbal women, like my daughter, are at an even greater risk because they cannot easily report the abuse. Women are 5 times more likely than men to experience sexual assault. According to a recent U.S. study, 99% of perpetrators of sexual violence are men. Many organizations have recognized these risks and adopted policies to reduce them, such as prohibiting solo staffing, implementing same-gender care for intimate support, and conducting unannounced inspections, and in some cases adopted video surveillance. Many organizations have Unfortunately, the organization where my daughter resides has not engaged in these risk reduction strategies. Instead, my concerns regarding my daughter's personal safety and care were minimized. Over the years, I made it very clear to the organization at every level that I do not consent to a male providing a personal intimate care to my daughter. 3 years ago, I learned, after the fact, that a male staff had been assigned to solo shifts overnight and had been providing personal intimate care to my daughter for 3 months without my knowledge. I was devastated. I immediately brought my concerns to management. To their credit, the male staff was removed quickly and replaced with a female caregiver for the overnight solo shifts. I have never opposed male staff in general. I value diverse caregiving and believe it benefits all. Let me be clear. Disabled people have the right to consent. Austerity and scarcity are not justifiable reasons to deny a person's care needs. When organizations care for the vulnerable people, their first and highest responsibility is to keep them safe. That duty must guide everyone, from frontline workers to executive leadership. At the time, I sat on the board of directors and brought this concern forward. While the board agreed that my daughter has the right to decline care from a male caregiver, they refused to revise the overall policy. Instead, they told me male staff would only be used for overnight shifts in rare occasions. That promise was not kept. In 2023 alone, the designated female overnight staff called in sick 96 times. Male staffs covered the solo overnight shifts over 25 times. In 2024, male staffed the home on solo overnight shifts 22 times. I raised this with management again and offered them several practical workarounds, which many of them had been used in the past, but I was told none were possible. My husband and I filed a formal complaint. In response, we were told that the organization does not share our concerns and would not consider gender-based care provisions. Not long after, the organization shifted from open to closed membership, removing the voice of families like ours from governance. As it stands now, when a male staff works solo overnight, my daughter must remain in a soiled pull-up until a female staff arrives in the morning. If she vomits through the night, she lies in it until a female staff comes in the morning to clean her up. This could be up to 8 hours. This is inhumane. It violates her right to cleanliness, safety, and dignity. I want to emphasize that I have been a long-time supporter of this organization. I served on the board of directors for 3 years. My concerns have always been expressed respectfully, but now I continue to advocate for my daughter's basic human rights, and I've been labeled as belligerent and threatened with a no trespass order. This organization even told me they would begin the process of disengaging with my daughter unless I sign off on the complaint and agree not to raise the issue of gender-based care ever again. I could not in good conscience do that. She is still not receiving the care she needs and deserves. I'm not suggesting that my daughter here is a child. However, in reality, she shares many of the same vulnerabilities of young children. So I ask you, would you allow your young daughter to go on an overnight school trip with a solo male as chaperone? Schools certainly have not allowed this for many years. Religious organizations and other organizations ignored these risks, and we have all seen the consequences. We must not wait for tragedy to act. We need to protect these vulnerable women now. I'd like to quote from Article 16.1 of the United Nations Convention on the Rights of Persons with Disabilities, which Canada has signed. Quote, "Parties shall take all appropriate measures to protect persons with disabilities from all forms of exploitation, violence, and abuse, including their gender-based aspects." This is not just policy, it's a human rights obligation. I lie awake at night worrying about my daughter's safety, her dignity, her human rights, and I will not stop speaking out for her and for all the women like her until those rights are honored. Thank you.
Good morning. My name is Angela, and this is my daughter, Eugenie. She's a little tired today. Eugenie's almost 24. She's nonverbal, and she lives with complex disabilities, including cerebral palsy and a seizure disorder. She needs full-time care for all activities of daily living. For years, I was her sole caregiver. We fundraised for therapy, equipment, and a wheelchair-accessible van. But after 20 years, I was exhausted. I had lost key supports. My father had passed, my mother had had a stroke, and I was terrified by one question: what will happen to Eugenie when I can't care for her anymore? We had funding, but it wasn't enough. The only way to access 24/7 care was through a group home. So, working with our local developmental services agency, we built a care plan that was approved and funded by the Ministry of Children, Community and Social Services. It promised physiotherapy, swimming, physical activity, and community participation. Supports essential for Eugenie's health, mobility, and happiness, and I was to remain an involved partner in her care as her mother, guardian, and substitute decision maker. But almost none of these commitments were honored. Physiotherapy and physical activity were neglected, Eugenie's strength and mobility declined, and I was heartbroken. When I raised concerns, I was told that I'd been misinformed, despite having a signed contract and numerous written commitments. Then came a zero-lift policy, whereby staff could no longer assist Eugenie to her chiropractic and massage appointments, or support her riding her trike or using her backyard swing. The agency even refused basic medical supports, like an enema they had previously agreed to. Instead, they suggest sending her to the ER when I wasn't available. That's not care. That's not dignity. It's also a misuse of our already overburdened healthcare system. After 2 years of advocating, the agency imposed a communication and visitation protocol upon me. I am now banned from speaking to any of the frontline staff who care for my nonverbal daughter. Instead of real conversations, I get weekly spreadsheets. I must give 48 hours notice to visit her and 2 weeks notice to take her home for a weekend. I am the only constant in my daughter's life, and yet the system has pushed me out. One staff member at her home who dared speak with me said the biggest disservice the agency has ever done to my daughter was to prevent staff from communicating with me. Another staff member who spoke up about my daughter's rights was fired. I've filed complaints with the agency, its board, my MPP, the ministry, and the Ontario Ombudsman to no avail. I was told the agency meets the ministry's quality assurance standards. And the ministry's solution? Move my daughter to another agency and start all over again, as if this wasn't her home and our hopes hadn't been invested here. Even then, there's no guarantee that things would improve because these agencies are funded regardless of whether they fulfill their promises. And this is a systemic failure. We're not asking for more money, we're asking for accountability and reform. The ministry's own Journey to Belonging plan proposes direct funding for residential supports, allowing families to manage their own funds, hire trusted caregivers, and choose how and where their loved ones live. But direct funding isn't planned to roll out until 2031, and that's too late. Direct funding already exists in other parts of the developmental services system, and it works. But residential support funding must flow through transfer payment agencies, where too much of it is lost to layers of management. So today I'm saying clearly, we need family inclusion and communication, including the rights of substitute decision makers. We need transparency, we need accountability, and above all, we need direct funding, and we need it now. We are asking for a system that values people over policy, because every day we wait, people like my daughter who cannot speak for themselves suffer. And this is not just our story. It's the story of families for accountability, inclusion, and reform, which include dozens of families across Ontario. Broken promises, families silenced, neglect, and very, very little oversight. Some of their stories are devastating, heartbreaking, unimaginable, yet painfully true. And most of them are too afraid to speak out, fearing retaliation. But I can't stay silent any longer. No parent should have to fight this hard anywhere, let alone in Ontario and Canada, to ensure their child has access to a safe, dignified, and meaningful life. Thank you.
Both of you did an incredible job, by the way. Absolutely incredible.
Thanks, Maria.
I'm going to speak quickly to a couple of things that these two lovely advocates raised. One, the same gender care. Lise Bourgeois, MPP Lise Bourgeois, critic for seniors and disabled, and I have been working on a Residents' Bill of Rights Act, and it will include the right for these children, these vulnerable, to have same gender care. And this comes about as a result of a case that I was involved in Ottawa, where the unthinkable happened between a male and a disabled young person. Fortunately for this young woman, she was verbal. She could communicate to me, and did to her MPP, John Fraser, as well, what happened. The other thing that I will speak to, and again, Lise Bourgeois has been avidly supporting these women as well as our seniors in the same situation. These women have raised trespass and visitation restrictions. The Trespass to Property Act is beautifully written, and our courts are the sole interpreters of any acts that the provincial or the parliament puts together. They can put the words together, but the sole interpreters are our courts, and our courts have said two things, just like the act. One, you cannot trespass the invited guest of the resident, and you cannot trespass a person with legally conferred authority, such as substitute decision makers or legal guardians. Our courts have said it, not me. The other thing is the Residential Tenancy Act. The Residential Tenancy Act does not, Section 22 of the Act, and our courts uphold that you cannot interfere with the full enjoyment of these residents. Visitation restrictions, like what she's been going through, Carolyn's been going through, are not legal. They're actually illegal. These homes act above the law because they can. There's no consequences. MPP Lise Bourgeois, again, has brought it up in the Legislative Assembly numerous times that they are not following these laws. They are not following their own laws, which is the bigger problem. So they can't protect our disabled persons. When these laws are, not followed, there are charter rights that are being infringed. These persons' charter rights. So when these mothers advocate for their disabled persons, there's the retaliation is swift, quick, and involves retaliation actually against, we see it against the mother, but it really is against the resident. It's the resident with all the rights. The resident's TPA rights, Trespass to Property Act rights, sorry. The resident's Residential Tenancy Act. It's their rights and their charter rights that are being infringed. And yes, again, Ford, Mr. Parsa, MPP Lise Bourgeois and I have written to them several times and informed them of even the charter violations. And nothing has happened. Because I don't think they care. I really don't. And what's the takeaway on this? If you are disabled in this province, and quite frankly this country, because I've got over 115 cases and some involve other places in Canada, heaven help you, because the law won't. Thank you. Sorry.
Well, tall. 3 years ago, a beloved son, friend, and member of the Francophone and Jewish community in Toronto died an untimely death in a group home. His family asked us to share this story on their behalf to raise awareness about the conditions in these homes and the need for urgent action to improve the lives of disabled people and group home residents such that no other community or family loses a loved one. He had spent his last year unable to leave the facility without supervision, which was inadequate. He was unable to receive the support he needed from the developmental service system. He ended up in this group home after spending 2 years in a hospital because there were no available supported spaces for him to live. A group home space was made available. It was not the Jewish group home that they had requested. It did not provide the required addiction support that their son needed. Another resident died that very same day that this unfortunate and beloved son arrived at his last group home. Was an investigation conducted by DSO? Was an audit conducted following an untimely death? We don't know for certain, but we do know that these structures are not in place for real, meaningful protection of disabled people in these systems. The family was promised 6 months at this home before he would move to Rena. While at this home, he received insufficient support at every turn. After not 6 but 10 months, the family was informed that he would need to remain at the home for another 6 months. Why? They were told if he was the same way we saw him before this residence, we would take him right away. Now it is impossible before another 6 months after reassessment. This group home made him unable to be supported elsewhere. At this time, this young man was struggling with the conditions of this home. The frequent craft dinner for meals, the noise of his housemates screaming and throwing furniture, the rules and the lack of structure. He was not allowed to go outside without a support worker, which due to low staffing was most days and most nights. He was struggling and trying his best to make it through. This young man needed individualized support, but his individualized funding was drastically cut by entering a group home. And we have spoken to so many other families who have experienced this exact same phenomenon, often after they have been told that moving into group homes would not impact their access to funding. While in the home, he was under strict rules. He was not allowed to go off premises or leave without supervision. These conditions changed him. He started smoking more than ever, as it was literally the only thing to do. His mom was concerned about his state and met with the DSO, telling them he will not survive in a setting that is not real life. His support staff shared this fear, telling his mom that they would also be depressed in the environment of this home, and that they were concerned he was slipping into a deeper depression such that he would not make it out of there. Through 2022, his family did their best to persevere so that he would be able to move to RENA and access the plethora of services that they provide. But he did not make it to RENA. He died from an overdose a mere 2 weeks after his 29th birthday. His life ended too early, and it followed decades of trauma inflicted by a complex web of government and government-funded agencies. The child welfare system, the court system, the children's group home system, policing, psychiatric institutionalization are deep failures in addiction treatment, and ultimately the developmental services system. This death and the ongoing deaths of disabled people in group homes that we have cataloged, counted, and named makes clear the urgent need for action for disabled people to thrive in this province. We need individualized portable funding and real accountability mechanisms. No more family members can be taken. Thank you.
Thank you, everyone. I want to thank Carolyn, Angela, Eugenie, Maria, Megan, and Lise for being here with us today, and to thank MPP Bell for booking the space with us and sponsoring this press conference. We'll now open for questions.
Hey, Brad. Jack Cowan from the Trillium. I was wondering if you could talk a little bit about how funding works now and what sort of issues personalized portable funding would fix.
Absolutely. I can speak to it a little bit. I'll pass to one of our family members if you'd like to add. But, on that, the funding system as it is structured right now is split between multiple ministries. So some of the funding is through the Ministry of Children, Community and Social Services. Some funding that could be relevant for home care is found in the Ministry of Health. And so, ultimately, our hope, I think, is to ensure that folks have a single accessible portal for funding that, can cover all areas of our needs of care without red tape and with clarity. I think that the current system, as folks have already described a little bit from their lived experience, is that ultimately when they enter group homes, disabled folks and their families lose out on funding, while, the existing group home system perpetuates violence and abuse. And so, our hope again would be a simple, single, and well-funded method to provide that funding to all disabled people in the province who need it. Would anyone like to ask?
Just to say that people who live in group homes and other institutional settings receive $149 a month in what's called an institutional allowance instead of ODSP. And so we know ODSP is completely incomplete and will not allow for people to be able to access their own apartments. But we also know that this institutional allowance rate is so dismal that it encourages increased isolation, because you can't do things with $149 a month, like pay your phone bill. And so what we're looking for is a more streamlined process that ensures that there's not disparities between institutionalized people and non-institutionalized people, and ensures that ODSP allows for people to live in community, because we know that so much of this is a result of people not being able to afford apartments because they are disabled such that they cannot work. And so that is a big piece.
I'm wondering if Brad or anyone else who'd like to speak to it. Do you think there's a place for group homes or other institutions in Ontario, or should they be eventually phased out altogether?
Yeah, I think I'll speak for myself here, and I think that, ultimately what we want to see is a vision of housing where folks, are able to live in the communities they grow up in, with their families, with their friends, with the people that they choose to have in community with, right? And so I think that, for me, the way the group homes are structured in Ontario feels very much like a return to the, provincial regional center system, a move back towards institutionalization, and a move away from, open life in community, I mentioned earlier in the release, and as Marie says, we don't need to be put away. And ultimately, I think that's all that the group home system is really achieving right now. I think that there are ways for us to live together collectively in cooperatives and in other spaces, but that we need ultimately, things like, livable amounts of ODSP and OW. We need to ensure that folks have funding that's personalized and direct for care. And ultimately, we need rent control. But, these are all things that, I think are a more sustainable vision than the current group home system.
And then lastly, this is maybe for Lise most of all, but what's been the response from the government so far?
Lise Vaugeois, MPP, Thunder Bay Superior North. It's been a non-response, really. About the Trespass to Property Act, we've been hammering away at that since I was elected in 2022. And we actually know that the Ministry of Long-Term is actually giving out false, incorrect information to institutions and telling them, yes, it's okay to use the Trespass to Property Act, although all the court cases say no, that is an incorrect use of the Act. Only the occupant of the unit has the right to say whether someone can come or not come. The owners of the home, the managers of the home do not have that right. But the government knows, so Minister Parson knows, all the ministers know, because we've written and spoken with all of them, and there has been no move whatsoever to correct this. We've heard so many things this morning, so many really tragic circumstances of people's lives that are not right. And this shouldn't be partisan. We all belong together. We are here as government. Our role as government is to provide supports, to share our resources so that we can support one another. And we don't see that happening. We see money being parceled off to special interests, to things like 401 tunnel. The list goes on of what the government's priorities are, and those priorities are not actually to look after people in a respectful and dignified way. Thank you. If there are no more questions.
Thank you all so much for being here and for tuning in online.